since 1974, Butterworth Laboratories has provided independent contract analytical chemistry science services to the global pharma and related industries, and consequently are considered leaders in quality control testing, method development, validation, transfer, and stability testing of pharmaceutical raw materials and finished products. So there we go. And David is the MD. So I think what would be marvellous, David, is if you could start talking, and then once I share the screen, then you can knock your video off, and I'll just go and head over to get the presentation set up. Over to you to start.
Well, thank you very much, Anne. Good afternoon, Anne and everybody. I think when Anne first asked me to do this talk today, I didn't first appreciate quite how much of our own experiences there was to talk about. However, I have tried to condense everything down a little bit as much as possible, so please do bear with me. It's also very interesting to compare our own experiences with those of the other speakers. I'll just stop my video as you requested. So, we've all faced some new and unique challenges over the last 12 months, and whilst trying to keep one's business afloat in the storm, it's sometimes easy to miss the subtle things which can help to maintain a happy and productive workforce. After all, they are the engine room on which we rely. We at Butterworths now employ 80 people, and experience has shown me that one of the biggest and growing challenges today facing employees is the matter of people's well-being and mental health. Our experience of mental health issues show they can manifest themselves in many ways, which are not always immediately apparent. So we're still learning ways to manage them, and where the causes are work-related, try and prevent them from happening in the first place. Unlike other forms of sickness, which have clear physical symptoms, it can often be difficult for a manager to understand what an employee is going through. And because symptoms vary and often invisible and fluctuate, it's not easy to judge how big an effect things are having on their ability to do things such as their job. Unfortunately, this can also sometimes lead to a suspicion of malingering or overplaying things, which can result in people being treated unfairly. In the same way that symptoms may vary too, so too are the causes. We have a responsibility to try and understand what elements of the work environment could lead to unhappiness and try to ensure that these are managed. I use the term managed because successful businesses still need to be stressful and challenging, but also can be rewarding. And we can't just remove all the stress out of the workplace.
Completely agree with that.
And one final thing on causes. In my experience, almost all cases where an employee has suffered from poor mental health, this has often been due to non-work related issues. And although we can't do anything about them directly to combat this, there are still things we can do in the workplace to help that employee cope. So I'm sure that a happy working environment, hopefully everybody agrees, can be key to preventing workplace mental health issues from arising in the first place. And an environment where they're recognised and destigmatised will also allow employees to feel more confident to discuss and report and manage things better. It's clear from my experience that different people have different tolerances, so it's also important that managers listen to their staff and monitor how they're coping. Sometimes it's best to look at someone's role and make adjustments if they're showing any signs of mental health fatigue, even if these are just temporary. However, as we learn more, that there is more of it than originally thought. It's very difficult to measure, or sometimes very difficult to measure, the effectiveness of all the actions taken, as there isn't really a reliable baseline. Often it comes down to a little bit of common sense and learning from experience, but providing training to managers to help them identify the signs and how to approach the issues helps to ensure that the issues are properly managed and understood and handled sensitively. If you could change the next slide, please, Anne. I sound like Chris Whitty, unfortunately. But, so Butterworth started off as a small family-run business. We're keen to retain much of that ethos still. And in fact, our high-level aims in our business plan are to encourage the best people to work for us and stay with us, to provide the best facilities and resources to accommodate the work we do and also the people that work for us. And then finally, thirdly, to provide sufficient profit to enable us to do the first two on an ongoing and sustainable basis. So as part of this philanthropic approach, we've maintained a tradition for providing our staff with rewards and assistance in many areas. And this, we hope, will make us a happier place to work. Although we're not a large company with unlimited resources, we are constantly building on our staff welfare initiatives. First, the most important thing we did was to hire an experienced HR manager in about 2017, and this promoted conversations about what we could do better. All the disparate welfare initiatives were collated into a single employee benefits welfare program. Next slide, please. This program included many common benefits, as I'm sure most people will have on their welfare programs, such as private medical insurance, accommodation and season ticket loans, cycle to work schemes, life assurance, income protection schemes. And we also have access to an employee assistance program. But we also included the formation of a staff committee, which enabled us to listen to what the employees have to say and also their concerns, and also provides consultation when we want to introduce new policies and allow us to communicate those to the staff. We also have social and events committee with company sponsored charity and sporting activities. In 2019, we introduced mental health first aiders. These are the same as a normal first aider, but they're specifically trained in mental health issues. And they are, their presences are known and they're spread around the workplace so that people know who to go to if they do have any concerns or wish to talk to somebody privately. We also gave direct access to our company's pension consultant to help provide personal financial advice. And the introduction of a reward and recognition scheme was a great initiative. The winners of which actually get to go to, well, hopefully, if we're able to, get to go to the Chamber of Commerce Business Awards dinner.
Oh, excellent.
It's an added incentive. I've got the plug in for you, Anne.
Excellent.
In 2019, we introduced a celebration of long service with awards of extra holidays. And we also introduced a large degree of management training that helped the specialist soft skills needed for good management of people. And finally, added to this, there's a share of profits with generous company performance-based bonus schemes. Next slide, please. But then there was COVID. Our business has probably been more fortunate than many others over the last 12 months. And also working in a highly regulated environment meant it was easier for us to interpret the regulations and turn these into in-house policies, and being able to rely on our staff to quickly adapt to the new requirements. Undoubtedly, this resulted in less stress and uncertainty from changes we had to make, but nevertheless, the changes still had an impact on staff well-being. Now, our business provides testing and supports the manufacture and release of medicines, including some COVID ones. So we needed to remain operational throughout. And our biggest challenge was actually how to handle an unchanged level of work whilst keeping everybody safe and happy. Some people could work from home, but the majority were lab-based, so they couldn't. So we had to find ways to keep them safe and perhaps more importantly, find ways to make them feel safe and happy in their environment, whether that be at home, in the office, or indeed the laboratory. Key to everything was communication. The staff needed to know that we were on top of everything, and the reasons for the changes to their working practices and environment were clearly explained. We also listened to their feedback and suggestions for further improvements. This helped to provide essential reassurance. Naturally, like everybody else, we use video calling to help keep in touch with people. And because this may be the only opportunity that some people had to see a friendly face that day. We also, funny enough, found that the use of video calling between desks reduced the movement of people on site, and this, helped to keep social distancing. At the same time, I started to send out weekly emails to help encourage a sense of oneness, despite the location issues. And this message was part journal of our progress, part reminders to keep safe, and also an opportunity to congratulate people for all of their good work. If I go to the next slide, please. So we put in place a range of measures which are probably common to most businesses, including home working for those that could or needed to, furloughing, although in our case this was very limited, providing additional PPE and so forth in the workplace, and the production of weekly risk assessments. But in addition, we also took the following measures which were intended to reassure and address the concerns of the staff. We adopted shift working patterns to reduce occupancy on site and also to improve social distancing. We changed working patterns so that people could avoid peak hours on public transport. Home working risk assessments that not only identified equipment needs to reduce general stress, but also assessing the individual's well-being. We produced a home working guide to help managers look after remote working teams, which also included guidance for assessing fatigue and stress. We introduced room and site occupancy limits to ensure social distancing. And we also invested in our own weekly lateral flow test program, way before the government scheme was actually introduced. Next slide, please. So what effects did we see on people's well-being? Well, we did see evidence of the following issues to a varying extent. We saw panic over the risk of catching COVID naturally. Obviously, loneliness and isolation as a result of home working. Stress from working in unusual or difficult conditions. General fear of the unknown. Concern over the use of public transport. Certain element of fatigue, and obviously, as we keep going through 12 months now, that's obviously starting to show itself a little bit more. And we also saw evidence of conflict with family or other household members, creating stress on the individual. Naturally, a lot of the attention was given to the off-site workers during periods of lockdown, but we also needed to make those coming into site also feel loved. And their main stresses were mostly around having to continue work in a less than optimal environment, sometimes on different days or hours due to shifts. Because we had good measures in place, regular risk assessments and good regular communication, the fear of catching the virus in the workplace was minimal. However, it did still exist. So to help with morale, we regularly bought them all pizza for lunch as a show of appreciation. And it's amazing, these small things, how well they are appreciated and how it helps to boost staff morale. Finally, on this, it's also important to note that different people have different tolerances of the perceived risk. So it's important for managers to have regular catch-ups to try and measure how people were coping. Not everyone had issues, and those that didn't have them all to the same extent. Have the next slide, please. So now that we can almost taste normality again, it's important to assess the short-term challenges. The COVID restrictions have effectively, in our workforce, created two distinct categories of employee, each with their own different issues. The first are those who have continued to come into work throughout the pandemic. They've been working at the coalface for over 12 months now, and most of them have not taken their full quota of annual leave. There's a risk of burnout. They're fatigued, and now that things are calming down, there's a risk that the return to the old normality will feel flat and, dare I say, unexciting. The second category are those who have mostly worked from home. Some have got used to it and are now reluctant to return. Often the thought of having to resume the daily commute is not appealing. And some still feel anxiety around their safety at work. Often these fears are not logical, as the measures taken in the workplace make it a considerably safer environment than the local supermarket, for example. There is also the potential to feel first-day nerves when returning back to the workplace, as everything feels different and new. And so all these people will need to be carefully brought back into the workplace. So we discovered there's a potential for people in either of the two groups to have problems once we return to normality. And because of this, we're now preparing and trying to anticipate what we'll need to do. Here's some examples. Firstly, ensuring that clear messages and transparent processes are provided to help ease anxiety felt by those returning to the workplace. We'll use 360-degree assessments to measure the impact to all stakeholders of home workers and the return to the workplace. Providing a controlled and phased return to the office for those who have been working from home or have been furloughed, and also increasing our numbers of trained mental health first aiders and providing additional awareness training for managers. Providing wellbeing webinars from our employee assistance program, and having regular catch-up sessions with those individuals that we've identified as potentially being at high risk. We need to encourage people to take leave on a regular basis, even if it is just a day off work. And we want to try and promote and increase the team culture by getting those returning more involved with those that have been on site all the time. And finally, really looking to reintroduce office or community get-togethers and other social events as soon as the regulations allow us to.
We need to whiz now, David, if it's at all possible, through the slides. Whiz through now.
Yep, I will whiz through it in a matter of minutes.
It's really interesting what you're going to apply going forward.
Will do. I'll go through as quick as I can. So clearly the effect of COVID and lockdown have put a strain on many people's well-being. We've had to look at better ways of managing this. What are the lessons learned? Well, most people agree that home working will become one of the most significant legacies of the COVID era. After all, many of us have experienced it and see the benefits it brings to the work-life balance, as well as reducing the stress from a lengthy commute. However, this change of policy needs to be carefully managed to prevent confusion and unhappiness, as the drivers for home working will probably change post-COVID. It's important not to confuse the two situations. I mean, currently the message is give a reason why you need to come into work, but once COVID is gone, that message changes to give a reason why it's beneficial for you to work from home. So we'll need to stop everything and then start again to try and remove any confusion and reduce any stress around that. The other thing about home working is there's a range of new challenges. Not everyone's job can be performed as efficiently as others whilst working from home. Where do you draw the line? This can lead to problems of fairness. During lockdown, we've been turning a blind eye to some of the minor home working health and safety risks, and it'll be harder to justify these post-COVID. And some people may be happy working from home, but others are not so happy with them working home. Naturally, managing people and their performance is harder, and managing mental health issues becomes more difficult. And there's always a danger that people can be set adrift and can remain remote. So because of this, we will obviously carry out extensive risk assessments on everybody individually to make sure the risks are fully understood. So in the last 12 months, we've helped to expose and draw, the last 12 months, COVID has helped us expose and draw a certain amount of attention to the potential for wellbeing issues to occur in our staff. And this has helped us discover what we can do in the future to manage it better. And also, probably more importantly, is realizing the power of communication, the importance of keeping in touch with those who are working remotely, to listen to people and understand what they're going through, providing clear, reassuring messages about the situation, and ensuring the technology exists to facilitate a stress-free operation. So in conclusion, final slide, thank you. I have 3 main points. You're ahead of me. Firstly, the COVID pandemic has made us look again at our employee wellbeing measures and add and adapt certain components to meet the new challenges ahead. In some ways, it's provided a drive for change, and in some of those changes will stick with us going forward. Secondly, I believe that we'll see an increase in mental health issues going forward. Now, some of these will be a direct legacy of COVID, but some will also be because we've learned to notice and understand them better. And finally, as a result of all of this, we've better understanding of how to manage well-being and mental health issues. We're now better equipped. But one last thing, amongst all of this, never forget your leadership team. Their role is often the most isolated, and it's important that they're also not forgotten. Thank you.
Excellent, absolutely excellent. So we've got some common themes here and some additional ideas and measures that you've taken that we can pick up and share with our businesses. Comms, listening and technology is rolling through, as well as the mental health additional points you raised. There's lots there, lots. Thank you very much, David.